We are continuing with our series looking at historical osteopathic authors and their descriptions of hands-on methods. In this case, we're looking at multiple methods, primarily focusing on the musculature surrounding the scapula, but we'll also move down essentially into the quadratus lumborum, or at least what Tasker says about the quadratus lumborum. So there was multiple slides. Make sure that before you get through this, you go back and pause to read those if you didn't. The instruction is there, so make sure you pause and read. Essentially, we go from the latissimus dorsi to the trapezius to the rhomboids to the serratus and essentially the dorsal musculature or the thoracic erector mass, and then the QL. So it's basically taking you down all of these, the layers of the back musculature, the posterior side of the torso, the different layers as Tasker describes them, such that we go from here all the way down, working on all of those. So the general assumption here is that when you see Tasker writing about relaxation, it's essentially predicated on, with the soft tissues, moving attachment points apart. So the attachment points of the latissimus dorsi essentially being a portion of the humerus, and then more or less the terminal end being the thoracolumbar fascia, so iliac crest and sacrum. So essentially you're stabilizing this, so this is relational motion. One thing stays still, one thing moves in relation to it. So the iliac crest is going to stay still and the arm is going to move. So your general latissimus dorsi movement looks like this. Now, what I will say is this: shoulders moving fine. If I really want to pay attention to the lat, holding on simply to the iliac crest isn't going to give me much information. What I might want to do is move further over so I can stabilize the iliac crest with my forearm, and I can palpate here, and then I can look for tension coming through, right? I can push with my forearm, I can push the pelvis backwards, and I can pay attention with both my eyes and this hand, even though this arm is going to have a lot of effort into it. So I'm going to feel the effort of my arm, the effort of my muscles as a larger stimulus. So I may not feel much with the up-table hand, but I can mobilize the pelvis, I can palpate through the thoracolumbar region, and I can use the arm as a lever. So I've got a short lever, a possible short lever. So fingers are a short lever, forearm's a short lever, forearm is a stabilizer, my fingers and my palm can be a stabilizer, and then I'm moving, in a relative sense, the arm, right, or the humerus. Now the next one is the trapezius. So the trapezius, he's speaking about the fact that the trapezius has a good span, and he also, in the picture, because you see the pictures, is he pins the humerus. You don't absolutely have to do it that way. What he's going to talk about is the multiple fibers. So because you've got the humerus pinned, so you've got good contact, lots of contact. The up-table arm, I want to wrap it around. Essentially the clavicle you can use as your concept, or the upper portion of the trapezius. And because of the multiple directions of the fibers, you take it all the way up for the lower fibers, all the way down for the upper fibers, and then all the way away from the spine for the middle fibers, right? So this is aiming at the trapezius. Again, the idea of relaxing the trapezius here is moving attachment points away from one another, right? So the scapula being the large attachment point, as well as the vertebral column through the thoracic region, as well as in the neck. So all the way down, all the way up, and all the way away. Now you will see that I will rotate the patient to some degree. I would say that there's different ways to do that. I would usually, if it was myself, for better contact and for me to reach less, I would actually do that standing behind the patient, because then I can control the humerus a little bit better. I can control the patient's body a little bit better. But for the case of showing what Tasker did, you're in front. Now the rhomboids, he talks about using the patient's arm against the practitioner's abdomen to wing the scapula. So basically you push it away, right? So that's your wing. What I would say is if you just lean into it simply, it's probably going to slide off your abdomen, so be careful there. What I would say is trap it. If you wanted to do this, trap, so bring the elbow towards you, trap here, right? Make sure the forearm's bent so you can trap it, and now you've got it winged, right? So you bring it up a little higher. You can see I've got good contact. So his forearm is the thing that's trapped between my arm and my flank or my side. And then I've got the rhomboid. So you can wing it. Now you're working on the rhomboids in his view. The next one is the pectoral muscles and the serratus. So what he's talking about again, keeping that concept that you're moving attachment points away from one another. So I want to move the humerus and the scapula as far away from the front of the ribs as I possibly can, which is what will get the pec. And then moving the medial border of the scapula away from the ribs as far as you can is what will get the serratus. So he does talk about moving the elbow back so the humerus goes away. You stabilize, right? You basically stabilize the thorax. So one thing moving in relation to another, stable thorax, moving humerus and scapula. And then that's his idea of really working on the pectorals as well as the serratus. The next one is working on the serratus as well as essentially the thoracic erector mass. What he has you doing is leaning, really, you lean so you drop the shoulder back and your forearm will contact the shoulder. So you drop the scapula as far back as you can, and you're going to push the shoulder, so you've got a long lever and a short lever. So this is where you start to get into the erector mass as far as Tasker is concerned. So short lever, long lever, and you're counter rotating, right? So I can move the erector mass, I can push the shoulder back, and as far as Tasker is concerned, this is working on the thoracic erector mass as well as the serratus. Whether he's accurate or not, you can question. And then as far as his QL method, again, you're moving attachment points away from one another. Slide your hips forward a little bit. Just don't want to reach as far. So working from the front again, 12th rib, TVPs in the lumbar column and iliac crest more or less, so you're just trying to move them apart. So he just talks about doing this, right? So the picture basically looks like this. What I would say is you're probably going to want to change your angle if you're in front of the patient, right? So I want to be able to push down there just a little bit, and then sometimes the iliac crest will work, sometimes it won't, sometimes you'll actually have to anchor on the trochanter, but that's more or less what it looks like. Palpating here so you can have a short lever again, relatively still muscle, moving bones, relatively still. Realistically in this case you need to move the bones for the QL if you believe this method in one way or another, which I don't necessarily agree with it as much, but it is what Tasker suggests. If I was interested in moving these muscles some way, what I would probably use is either a different position or a longer lever. A way to modify this is you straighten the top leg, and then that creates some more or less some traction. I can move down the table, right? So as the leg comes across the body, I'm already creating essentially side bending to the down table side. I can anchor here, keep these muscles still, the erector mass more than anything, and then I can pull the ilium away, or that side of the pelvis away from the ribs. So that's another way to modify it, but that's essentially all of Tasker's methods, working through the 4 layers of the muscle, of the muscles of the back, essentially from top to bottom.